Welcome to today's lesson on coronary heart disease, which is a type of non-communicable disease. In this session, we will explore what coronary heart disease actually is, as well as how it occurs. In our lesson today, we will first define what coronary heart disease actually is. We will then move on to study the mechanisms that underlie its occurrence. Specifically, we will examine how the arteries that supply the heart with its blood can become narrowed or blocked, which ultimately leads to this condition. So far, you have learned about the structure and function of the heart and blood vessels. You understand how blood flows through the heart and the blood vessels to supply oxygen and nutrients to the body. Disruption of this process can lead to severe issues for the heart, as well as for the rest of the body. Recognizing how coronary heart disease occurs is essential for cardiovascular health, as well as for understanding broader implications for patient treatment and care. To start, let's get familiar with the heart's structure and its blood supply. The heart is composed of cardiac muscle cells, which are unique specialized cells that contract to pump blood throughout the body. Like all other cells in the body, these cardiac muscle cells need a steady supply of oxygen and nutrients to function effectively. They also need to remove waste products such as carbon dioxide. The heart itself receives its blood supply via the coronary arteries. These arteries branch off from the aorta, the largest artery that is found in the body. Coronary arteries sit on the outside surface of the heart. The primary function of the coronary arteries is to deliver oxygenated blood, as well as essential nutrients, to the heart muscle. Coronary heart disease occurs when the coronary arteries become narrowed or blocked. This narrowing or blockage is due to the buildup of layers of fatty materials. These are commonly referred to as plaque. This buildup happens gradually over time and is influenced by lifestyle factors, diet, as well as a genetic predisposition. Plaque formation begins with damage that occurs to the inner lining of an artery. Factors such as high blood pressure, high levels of cholesterol, smoking, or diabetes can contribute to the damage. Once the lining is damaged, fatty substances, cholesterol, cellular waste products, calcium, and fibrin, a clotting material in the blood, accumulate at the site of injury. This accumulation is referred to as plaque. Over time, the plaque hardens and narrows the lumen, which is the interior space of the coronary artery. As the lumen of the coronary artery narrows, the flow of oxygen-rich blood to the heart muscle is reduced. The heart muscle then becomes deprived of its necessary oxygen and nutrients. If the plaque continues to build up, or if a piece breaks off and forms a clot, the artery can become partially or completely blocked. If a coronary artery is only partially blocked, the heart muscle may still receive some blood flow, but it will not receive enough, especially during periods of high demand, such as those that occur during exercise. This can ultimately lead to symptoms such as angina, which is chest pain or discomfort. If a coronary artery is completely blocked, the area of the heart muscle that is supplied by that artery can no longer receive oxygenated blood. This situation prevents the affected heart cells from respiring aerobically. Without oxygen, the cells in that part of the heart can die. This can lead to a heart attack, which is also known as a myocardial infarction. A heart attack is a serious medical emergency. The death of heart muscle cells can cause permanent damage to the heart and can be life-threatening if not treated promptly. Symptoms of a heart attack may include severe chest pain or discomfort, shortness of breath, sweating, nausea, and lightheadedness. To summarize, coronary heart disease is a condition where the coronary arteries become narrowed or blocked due to the buildup of plaque. This reduces or completely blocks the blood supply to parts of the heart muscle, preventing aerobic respiration and potentially leading to a heart attack. Understanding how coronary heart disease occurs and its impact on the heart is essential for both preventing this condition and treating it when it occurs. Watch the rest of the GCSE biology course at Sophos Education.